Hi, Walter Tatch here. Today we're going to look at the case where we took the patient from tooth-supported bridge work, temporary bridge work, to an implant-supported bridge work using sequential extractions. So here's our patient. She is in her mid-50s. She's got fairly low smile line, so she's not really showing a lot of gum when she's smiling. Intraorally, we've got advanced periodontal disease, cervical recession. There's recurrent decay as well. When we're looking at the panoramic X-ray, we can see that on the right side she was previously restored with 3 maxillary implants and a sinus lift, which appear to be solid. The soft tissue around them looks healthy. And on the left side, she's missing tooth number 14 and has advanced pneumatization of the sinuses. So, to summarize, we have a patient with failing upper dentition, recurrent decay, periodontally involved teeth. So the treatment options include all-on-5 or all-on-6 or tooth express, essentially implant-supported fixed prosthesis. That option would require removal of existing implants and moderate alveoloplasty to create the vertical space required for the prosthesis. Another option includes placement of some individual implants for a implant-supported bridge work. So how do we take this patient from having teeth to convert them to implant-supported prosthesis without the need for them to wear anything removable? Well, our treatment option here included extraction of certain teeth. We're gonna plan on, after consultation with a restorative dentist, we're gonna plan on keeping teeth number 7, 11, and 13. The teeth are going to be prepared preoperatively, and a temporary crown will be placed on those teeth. Also, a laboratory is going to fabricate a temporary bridge work in anticipation to extraction and post-operative placement of that temporary bridge work. From a surgical standpoint, the plan is to extract teeth number 6, 8, 9, 10, and 12, and we're going to go ahead and perform immediate implants on number 6, 8, and 12. We're also going to perform a left maxillary sinus lift in preparation for placement of implant number 14 at a later time. The connective tissue grafting is going to be performed using an alloderm in this particular case. We have a lot of cervical recession, even though the patient does not have a high smile line. We want to examine that tissue and improve the tissue height as well as the thickness of the tissue and the quality of the tissue. The patient after the surgical procedure is going to be referred back to the restorative doctor, and an immediate temporary bridge on teeth number 7, 11, 13 will be inserted immediately after that surgical procedure. So this was a post-operative panoramic X-ray. You can see the immediate implant placement and a temporary bridge that's supported by 3 teeth. David Garber once said that hopeless teeth are not useless teeth, and in this particular case, we're utilizing teeth that will eventually be removed, but using them as a temporary anchors for a temporary bridge. So the patient does not have to wear removable prosthesis. Not only the advantage of wearing a fixed prosthesis here for the patient comfort and overall experience, a much better positive experience of the treatment, but also keeping the pressure away from the tissue, where it's allowing for nice healing to take place. This is 3 weeks post-operative. There's no way that the tissue would look like this if the patient was wearing a partial denture, for example. Also, a temporary bridge work allows us to start shaping the papilla, shaping the tissue, and really scalloping it for the final prosthesis. So this is 3 weeks later. The patient is going to come back. We're going to remove the temporary bridge. We're going to evaluate the tissue, evaluate the healing, and go ahead and remove some of the sutures here. The bridge is going to go back in place, and the patient is going to heal for about 3 months. When the patient returns in 3 months, this is what the tissue looks like. It's a very nice healing that we see here with the soft tissue. Slightly hyperemic in a few areas, but overall the tissue looks great. The implants are going to be checked for integration at this point in time using osteals, and we achieved very nice osseointegration at this point in time. So the patient is going to be referred back to the restorative doctor, and the plan here is going to be to take impressions of those implants and fabricate now implant-supported prosthesis. The implant-supported prosthesis or a temporary bridge is going to be utilizing now implants number 6, 8, and 12. And once it's fabricated, our surgical plan is going to be coming back and extracting tooth number 11, performing an implant there, and placing an implant in the area of number 13. To avoid cantilevers, we're going to temporarily keep tooth number 13, and instead of including in the bridge work, we're going to go ahead and place an individual crown, the temporary crown, for the next 3 months. So this is a post-operative panoramic X-ray showing exactly what we're able to achieve. Tooth number 11 was extracted, immediate implant was placed, and we went ahead and did inserted the temporary bridge work on those already integrated implants, and also placed an implant in the area of number 14. So 3 months post-operatively, this is what the patient looks like. In the vest, we see a little tiny red area. This is one of the sutures that was remaining there from the alloderm tissue graft that was left there, that was removed prior to taking the picture. But you can see what tremendous difference we're able to achieve. Now the tissue profile looks great. We have a nice scallop tissue, and improved, which improved significantly from preoperatively. We now have implant-supported bridge, and implants number 14 and 11 have integrated. So the final restoration is going to be done via 2 bridges. It's going to be completely screw-retained. The accesses are at the cingulum here, you can see, so there's going to be a bridge from utilizing number 6, 8, and 11. That's a screw-retained bridge. And another bridge work from 12 to 14. And this is what the patient's final restoration looks like. A very nice aesthetic, very nice smile line, and we're able to convert the patient essentially from dentate, from failing dentition, to a fixed implant-supported bridge without her ever wearing anything removable. So overall quality of her experience is significantly better versus if she had to wear anything removable in this particular case. I thank you for your kind attention, and this is a case of sequential extraction. Thank you.